Our topic is group homes in Ontario.
By Billie-Rose and
Temina Zedi. Group homes are created for individuals with disabilities, illness, or chronic diseases. Individuals who live in these homes have to pay rent them and they live without their family members independently. Group homes are available around Ontario and have the options for individuals who cannot afford them to receive funding through the government through various different agencies. These group homes are not just a place for individuals to stay in, but they are made in a way where they help accommodate the special needs of the individual residing within them. They provide a range of service from basic accommodation, care, supervision, and attention for complex and medical needs. Accommodation in group homes. Group homes are positive accommodation for individuals with disability which help accommodate the lives of these individuals. But just like any service within the community, there are many barriers. Firstly, the increase in population causes a barrier to individuals who want to access their homes. There are not many group homes in the community, which causes huge wait times to be accepted in to live in them. Secondly, the increase in cost in another barrier. Group homes have recently seen a rise in the rent, which makes affordability a barrier in accessing these group homes and aging parents. Lastly, the most important barrier is not being able to appropriately match individual with the appropriate group homes. In other words, when a needs assessment, initial assessment is conducted on the individual interested in living in these homes, they are not accessed properly. They are put into homes where their needs are not often met and they have no choice but to stay in them. This prevent from these individuals receiving the proper treatment and necessities based on their disabilities or illness. Cost associated. In order to get funding from the government, there is a huge wait list, and once an individual is eligible for the funding, there are even longer waiting period to receive the fund. And the rationale behind all of these wait time is because the increase in demand for housing than resources available in Ontario. Cost associated. Continue. As mentioned previously, the cost to live in a group homes are extremely expensive. Individuals who do not get funding in order to reside in these struggle to pay for the housing for individuals with disability. The cost to live in a private group homes in approximately 90,000 a year. Even individuals that receive funding to live in these group homes find it a challenge because the government will only pay for basic needs and there are many limitations attached to the funding they receive. There are also major gaps between the support provided to these individuals and the actual care needed to help them survive independently in these homes. Waitlist. Getting into a group home is definitely not an easy task for anyone. The list of individuals waiting to be eligible to live in a group home is longer than the list of individuals living in one. Ontario offers about 18,000 spaces for public group homes, but thousands of individuals are put on wait lists for air. Financial support hardly covers the therapy, let alone housing. Just because you are on waiting list does not mean that you are guarantee a spot of one becomes available. Many are denied service even after being on wait list to get access for funding. Since 2008, families residing within the southeast region have seen an increase by 30% in the wait time. Wait lists continue. Due to extremely long wait lists, some individuals live in hospital or declare homelessness because there are rarely any place for them to live. Due to small amount of group homes and increase in amount of individual wanting to reside within them, some people are forced to wait for patients to pass for a spot to become available to them. Long waiting. Parents with intellectual disability to find a home and service start early and can last decade, and also there is no national figure on the number of people waiting for group homes.
access to group homes. There's many different residential adult supportive housing options to take. 1. Custodial housing, which is around-the-clock supervision, assistance with aspects of daily living tasks, and medication care. 2. Supportive housing, community involvement, PSW supports, usually in a group home setting but can be accommodated for the own house. 3. Supported housing, community involvement, housing and care is separate from outside services provided and is usually in a co-op or apartment buildings with others requiring support. There's also different types of support group homes and living supports, individualized residential supports, best for all overall needs. It's very individualized for each individual. Access to group homes. Planning for your loved one to transition into residential housing or support requires a lot of thinking, mainly the 3 factors. 1. The appropriate house and the cost around it. 2. The constant expenses for a household. And 3. The appropriate services and supports. You have to make sure the individual needs are appropriately met based on their abilities, skills, transit needs, medical needs, amusement needs, or financial needs. Ask yourself if they have developed the appropriate skills related to running a household or if they should be living with someone else. Schools are not helping to transition these young adults into full adulthood. Community Living Ontario is a non-profit organization with 117 local organizations to assist people with a range of different disabilities. It's a great start when looking for group homes in Ontario. There are 9 developmental services in Ontario divided into regions to assist families. Contact your local developmental service or agency for information on how to access these group homes and find more accommodation that works best for each individual. There is another issue of aging parents. Aging parents of aging adults with disabilities are burning out and crashing due to the demands put on them by their child. Their child's on the wait list and therefore not receiving residential group home support, and they are left to stay with their aging or elderly parents and caregivers who cannot handle it anymore. Many parents have their own health issues and are unable to care for their child with disability. The wait lists are sometimes years or decades long, leaving these parents or caregivers for a very long time while they are also aging. Parents can get tired as they are 24 hours caring for their now adult child. The parents are scared that if something happens to them, where does their adult go? If parents pass and their adult children are still not receiving residential support due to wait lists, they will be placed in facilities that are not suitable for their needs. They could also be placed anywhere, losing their current jobs, regular day programs, friends, mentors in the current community, and the structured support that they are used to. There are different types of barriers associated with group homes. Restricted housing options to choose from, discrimination within the group homes, a higher poverty rate, not affordable, lack of housing actually available, and not enough government funding. In class, we discussed the social model. This is used to describe that the society is the problem and not the person with a disability. It limits involvement for someone with a disability. There are 3 types of barriers: a physical barrier, referring to physical surroundings; communicational barriers, referring to someone being inaccessible to information; and 3, attitudinal barriers, referring to the one's attitudes about a person's disability. And that's what we're going to focus on next. An example of an attitudinal barrier towards people with disabilities living in group homes is back in 2014 when Doug Ford, the Toronto mayor, accused a group home sheltering 3 autistic young children of ruining the neighborhood with no actual support. His attitudes of young adults with disabilities living in the group homes were deviant and therefore devalued by people in society. Deviance is the way society behaves towards someone who is different or doesn't belong, and is negatively valued. People who are considered deviant by the mainstream of society, and in this case the boys who lived in the group home and happened to have autism, were considered to be deviant by the mayor of Toronto. The mayor, who is well supported and has a high social status, is sending a message to people over the world, a stereotype to people with disabilities. He is portraying them as deviant and bad for ruining the neighborhood. This devalues a person and makes them isolated and promotes negative social imagery, which is not helping us move forward as a welcoming and engaging society. Doug Ford perceived young adults with disabilities as 1, objects of dread, someone to fear, that all of these young adults living in group homes are bad, all they do is ruin the streets of Toronto. 2, a menace, someone who is threatening or likely to cause harm. These young adults are causing harm in the neighborhood, as he accused them of. And 3, an internal child, someone who will always be childlike. He's assuming that because of their disability, they will always be childlike and always be ruining things. Their role perceptions have a lot of influence of others and individuals with many negative life impacts. He used the medical service model by viewing the disability autism as the problem. We need to adjust our way of thinking and promote new values, inclusion, and integration into our society and not fall trap of devaluation as it has very negative impacts on people. There is a new action plan for Ontario. As the 2018 Ontario budget has introduced a new investment of $1.8 billion for developmental services and supports people with disabilities. It's to improve wait lists, costs, and government funding. In conclusion, group homes are an excellent type of support services for families and adults with disabilities. There are still many issues around group homes, including appropriate group homes based on the needs, costs associated, wait lists, and access, aging caregivers, and many attitudinal barriers and role perceptions about group homes, viewing them in a very negative light. Unfortunately, we should change our society to make sure that they are all viewed into a positive and engaging and inviting light. Thank you.